Vital signs and oxygen administration. Chapter 6. Measuring vital signs. Vital signs are also called cardinal signs. Body temperature, pulse, respiration, blood pressure. Changes in vitals indicate a potential problem. Vitals. Oxygen is vital to survive. The human brain cannot function for longer than 4 to 5 minutes without oxygen. It is your responsibility to know what are normal vital signs. Vital signs. A physician's order is not required for vital signs to be measured. Unless a nurse is present, it is your job to take vital signs on a patient. Body temperature. Defined by the heat produced in the body tissues to the heat lost to the environment. Can vary 2 to 3 degrees. Body temperature is controlled by the basal region of the brain called the hypothalamus, body thermostat. Facts. The environment, time of day, weight, emotion, exercise, disease, digestion of food and injury all have an effect on temperature. Fever or pyrexia is elevated temp. As body temp increases, the body's demand for oxygen increases. Temperature ranges 3 months to 3 years is 99 degrees. Symptoms of a fever are increased pulse and increased respirations, itchiness, flushed dry skin, chills and loss of appetite. Low body temperature is called hypothermia. Hypothermia can be an indication of a pathological process and can reduce a patient's need for oxygen. Measuring temperature. There are 4 ways to measure temperature: oral, tympanic, rectal, axillary. Measuring temperature. Average oral reading is 98.6. Average rectal reading is 99.6. Average axillary reading is 97.6 to 98 degrees. Average tympanic reading is 97.6. The site selected for measuring temperature must be chosen carefully depending on state of mind, age and the ability to cooperate. Alert. Patients who are disoriented, delusional, delirious or WHO have facial injuries or a history of convulsions should never use an oral thermometer, tympanic thermometer. This is placed in the ear and is called an oral thermometer. Measures the blood vessels in the tympanic membrane of the ear. Axillary. Safest method of measuring body temperature. Useful for infants. Rectal. Most reliable measure of temperature. Close proximity to the core of the body. Pulse. As the heart beats, blood is pumped in a pulsating fashion into the arteries. This results in a throb sound. Pulse apical, over the apex of the heart, heard with stethoscope. Radial artery of wrist. Carotid, front of neck. Femoral, groin. Popliteal, back of knee. Temporal, front of the ear. Dorsalis pedis, top of foot. Posterior tibial, inner side of ankles. Pulse. The normal average pulse rate in an adult is between 60 and 90 beats per minute. The normal pulse for infants is 120 beats per minute. A child 4 to 10 years old 90 to 100 beats per minute. Assessment of the pulse. Pulse assesses cardiovascular function. Tachycardia is a rapid heartbeat, over 100 beats. Bradycardia is an abnormally slow heartbeat, below 60. Pulse rate should be counted for a full minute. For infants and children, the apical pulse is most accurate. To assess the pulse, you need a watch with a second hand. Respiration. The average rate of respiration for an adult is 15 to 20 breaths per minute and 30 to 60 breaths for an infant. Respiration less than 10 breaths per minute may result in cyanosis, apprehension and a change in consciousness because of inadequate oxygen. Assessment of respiration. Keep patient in present position. Observe chest wall for symmetry of movement. Observe skin color. Count the number of times the chest rises and falls for 1 minute. Blood pressure, in general terms, is defined as the product of flow times resistance. Blood pressure is the amount of blood flow ejected from the left ventricle of the heart during systole and the amount of resistance the blood meets due to systemic vascular resistance. Blood pressure facts. Blood pressure varies with age, gender, body position, time of day and health status. Blood pressure is usually lower in the morning after a night of sleep than later in the day. Blood pressure facts: men usually have higher blood pressure. Infants have higher blood pressure. Sphygmomanometer is the instrument to measure blood pressure. Facts continued. Blood pressure requires 2 readings and is measured in millimeters of mercury. The 2 readings are called systolic and diastolic. Systolic is the top number. Diastolic is the bottom number. Systolic. This reading is the highest point reached during contraction of the left ventricle of the heart as it pumps into the aorta. The normal systolic pressure is 110 to 140. Children range from 90 to 120. Adolescent ranges from 85 to 130. Diastolic. This is the lowest point to which the pressure drops during relaxation of the ventricles and indicates the minimum pressure exerted on the arterial walls. The normal range is 60 to 80 in adults. Children's diastolic is 50 to 70. Adolescent pressure 45 to 85. Hypertension. A patient is considered hypertensive if the systolic pressure is greater than 140 and the diastolic pressure is greater than 90. Blood pressure cuffs. The blood pressure cuff should be selected according to the patient's size. A cuff too large or small will give an improper reading. Oxygen therapy. Oxygen is essential to life. Oxygen cannot be stored and is dependent on the environment. It is your responsibility as a radiographer that equipment to administer oxygen is available and working. It is your responsibility to assist with administration of oxygen in emergency situations. The amount of oxygen in either air or blood is called oxygen tension. Inadequate oxygen is called hypoxemia. When too much carbon dioxide is retained in the arterial blood, it is called hypercapnia. Pulse oximetry. A device placed at the end of a patient's fingertip or earlobe and measures oxygen saturation of hemoglobin. Normal oxygen saturation is 90 to 100%. Below 85% indicates the tissues are not getting enough oxygen. Hazards of oxygen administration. Oxygen is considered a medication and must be prescribed. Special care is necessary when administering oxygen to COPD patients. Infections and bacteria thrive in oxygen environments. Be certain that tubing, cannulas and masks are used one time and for one patient only. No smoking around oxygen delivery systems. High flow rates require humidification to prevent dry mucous membranes. Oxygen is piped to rooms in a hospital to a wall outlet. A flowmeter is attached to each wall outlet. Types of oxygen delivery systems. Nasal cannula. Nasal catheter. Face mask. Oxygen tent. Equipment needed for the imaging department. Oxygen source, tank, piped in. A sterile cannula or mask in a sealed packing. Connecting tubing. A humidifier, if needed. A flowmeter. A no smoking sign. Chest radiography. Placement of tubes. Critical thinking. Pathologies and technique. Portables. The end. Oxygen delivery will be taught more extensively in topographic anatomy 2.